You also want to invest in a certified elder attorney. The certified elder attorney will help manage the financial assets to determine what the person can afford and what they cannot afford. Medicare does not pay for non-medical long-term services and support. So someone to come into the home to provide non-medical care, the bathing, the dressing, the cleaning, that comes out of pocket. Family caregivers are the backbones to the long-term care system. And if we do not get support for family caregivers sooner than later, the system is going to break their backs. That is full stop. On average, the cost of non-medical care can range anywhere from $3,500 to $5,000 a month. And we're talking about on average over $100,000 from in-home care to assisted living. And so education first is key to determine what your Medicare covers and what it doesn't. And then just like you plan for your children's college fund, you also want to plan, and I'm talking to us, Gen Xers, Gen Zs, you also want to plan for your long-term care as well. But for those who are already over 65, they're in the throes of it, seek the assistance of a certified elder attorney and do some Medicaid planning. Unfortunately, in America, you have to go broke in order to be able to afford long-term services and supports because Medicaid would cover it.
And if you're in that in between and you say, hey, I don't qualify for Medicaid, what are some resources that they can identify to help take care of that family member?
I love that question. I call those individuals the gap generation caregivers. And so those caregivers are typically sandwich generation caregivers, average 49, 50 years of age, caring for an older adult loved one, a parent, and also caring for their own family and still working. And so the area agency on aging, the local area agency on aging, they have vouchers that can help with respite care. That's where someone comes in to sit and care for your loved one while you go to work or take a break because you have to practice self-care, GUIDE. For those who have traditional Medicare, not Medicare Advantage, but traditional Medicare, Medicare is now providing financial support for in-home care. They're providing education and resources to help family members that bear the brunt of the responsibility, how to train them and educate them on how to manage the dementia care at home, non-prescription. Also, they provide a geriatric care manager like myself to help families and seniors better understand the long-term care system, get services in place, and to better understand what to expect from these services. Also, you want to tap into your local universities. Typically, universities, their social work program, their nursing programs, their public health programs, they may have grants. Many of them do have grants to help with dementia care, better understanding Alzheimer's care, and mild cognitive impairment. And they typically have grants to whereas they may provide funding for in-home care, but also education, because education is so vitally important. I'm from a small town in South Carolina called North South Carolina, and just about everybody who was aging had dementia, but they really didn't. They were just aging and they were dealing with maybe mild cognitive impairment or age-associated memory loss. And so those are the things that we need to be mindful of. There is now a treatment for early stages of Alzheimer's disease. Early onset is something different, but you have to catch it in the early stages. So education is vitally important. If you recognize the signs in the early stages, you could have access to the new treatments to not cure the disease, but it can slow down the progression of Alzheimer's disease, thereby affording the senior and the family caregivers a longer quality of life and their independence.
And you mentioned something so important, early detection, right? And
early detection is key.
Right. And if you're someone with dementia, of course, you may not see those early signs. So what are some of the things that family members can say? Hey, if you're seeing these signs and symptoms, you may need to take your loved one in to actually get a diagnosis.
So I'll say the person that's experiencing it, Dr. Hilton, they actually have been experiencing it anywhere from 15 to 20 years before anybody even notices it. So they typically hide what they can't remember and what they're experiencing, because the last thing any of us want to lose is our mind. So we try to, justify why we're forgetting certain things. But Alzheimer's and progressive types of dementia is much more than memory loss and forgetfulness. When the forgetfulness begins to impair a person's life, meaning I might forget your name, but I remember who you are. I remember where I met you, and we can have a meaningful conversation. It's going to roll off my back. It's when that forgetfulness causes emotional trauma.